What's that?
Getting you the motion. No, I was up there. Good afternoon, Madam Chair and members. As we know, the Affordable Care Act provides many new consumer protections to make health insurance more affordable and available. These include protections on cost sharing, such as actuarially value requirements and placing annual limits on out-of-pocket costs, as the out-of-pocket costs are the portion of the healthcare expenses paid by an insured customer in the form of deductibles, co-payments, or co-insurance payments paid to the healthcare provider. One of the many individual market reforms California enacted while implementing the Affordable Care Act was a provision that prohibited plans and insurers from altering premiums during that plan year. This essential patient protection, while meaningful on its own, does not currently apply to cost-sharing requirements across all the markets that we have in California. This bill will ensure health care consumers are actually provided what they were promised when they sign up for coverage, by prohibiting a health care service plan or health insurer from changing any cost sharing requirements during that particular plan year. Several entities have expressed concerns about the cost sharing changes that may have happened when a drug moves from one tier to another mid-year. And members, with that, I respectfully ask for an aye vote. I have individuals like to speak in support of the measure.
Beth Capel on behalf of Health Access California. In the many bills we have done to implement and improve on the Affordable Care Act, we thought we'd already taken care of this, but it turns out we had not. We thought it was the case that if you bought a policy at the beginning of the year and you thought your deductible was $1,000 and your copay to go see the doctor was $25 and your copay for a brand name drug was $25 and the one for a generic was $10, that they couldn't change it on you in the middle of the year. But it turns out we hadn't quite closed the door on that, and so this bill is necessary to make sure that that's true. But if that brand name drug goes from brand name to generic, then of course the price, the copay would go down from $25 to $10. But what should not happen is the copay for that generic drug should not jump up from $10 to $15 in the middle of the year. You bought the policy for the year, you should know what's in it for the year. That's the point of this bill, and we're happy to be here in support.
Madam Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty, also here in support. It's important for consumers to have certainty about their cost sharing. It's particularly important now that we've implemented the Affordable Care Act and people can only buy coverage during the open enrollment period. So if they buy coverage and it changes, it's important for them to be able to know that the cost sharing will remain constant for the year. We're pleased to be here in support.
More sports?
Good afternoon. Michelle Cabrera with SEIU California in support.
Autumn Ogden with the American Cancer Society Cancer Action Network, also in support.
Sarah Phlox, California Labor Federation, in support.
Emily Rush, the California Public Interest Research Group, or CalPIRG, in support.
Julie Broyles on behalf of the California Association of Health Underwriters, in support.
Misty Johnson on behalf of the California Pharmacists Association, in support.
Support or opposition?
Well, Madam Chair, Nick Louises with the California Association of Health Funds. We actually don't have a position on the bill. We don't think under existing rules the structure of the benefit design can change. We're just seeking some clarification per the author's comments in his intro about the intent of the bill and may seek a clarifying amendment, but we're working with the author's office.
Stephanie Watkins on behalf of the Association of California Life and Health Insurance Companies. I just echo my colleagues' comments and that we look forward to working with the chair as the bill moves forward. Thank you.
Skylar Wood, family physician and member of California Academy of Family Physicians, in support. Thanks.
Any questions from Senator Roth?
Thank you. Are there circumstances that might arise during a plan year? New procedure, new drug, something that might necessitate a change? And if so, if that's an intelligent question, how do we deal with it?
You're on.
Beth Capel for Health Access California. One of the things that California has done that is quite remarkable is that Covered California has standardized benefits in the individual market, so that you know when you buy a platinum plan that your drug copay is literally is $10, and that you know that for the year. We, in the process of doing that, have gone through an astonishing amount of detail. Frankly, if I'd ever known I'd have to sit through all these conversations, I might not have proposed standardizing benefits, but we've gone through an astonishing amount of detail to try and think through questions like that. And what I would say is the plan prices for the year, the consumer relies on the cost sharing for the year. The thing that matters the most in terms of driving the actuarial value is the out-of-pocket maximum, and that's generally not what's adjusted in this kind of adjustment. It's a change in a drug copay or the copay for a procedure. For some things, coinsurance is in place, and that's, 20% coinsurance rather than a flat dollar amount, so that allows some adjustment. We have tried to anticipate those kinds of changes, and I would say the Covered California process, which is an iterative and annual process, as is the process for plan review, for product review for the premiums, allows for that already. So we think it's, from year to year, there can be change. The point of this bill is nobody gets surprised in the middle of the year.
Any further questions? Mr. Chairman, would you like to close?
Respectfully ask for an aye vote, Madam Chair and members.
Thank you. Is there a motion? The motion, please call for the vote.
Hernandez? Hernandez, aye. Nguyen? Hall? Hall, aye. Mitchell? Monning? Aye. Monning, aye. Nielsen? Pan? Aye. Pan, aye. Roth? Roth, aye. Wolk?
And this is due pass to appropriations, and we'll leave it open.
Thank you. Can we, Sergeants, can we call Senator Mitchell and Senator Wolk, and this way we can open up the roll? Item number 1, SB 923, current vote count is 5-0. Call the absent members.
Nguyen. Mitchell. Aye. Mitchell, aye. Nielsen. Wolk.
Current vote count is 6-0. We'll place that bill on call. Item number 2, SB 955, Bell. Current vote count is 5-2. Call the absent members.
Mitchell.
I'm sorry, current vote count was 5-2?
Yes, 5-2.
Mitchell, aye.
Mitchell, aye. Wolk.
Current vote count is 6-2. We'll place that bill on call. Item number 3, SB 1002, Monning. Current vote count is 5-2. Call the absent members.
Mitchell.
Aye.
Mitchell, aye. Wolk.
Current vote count is 6-2. We'll place that bill on call. No problem. Okay, we're going to go ahead and open the roll. We're at item number 1, SB 923. The current vote count is 6-0. Call the absent members.
Nguyen. Nguyen. Nielsen. Wolk.
Aye.
Wolk, aye.
Current vote count is 7-0. That bill is out. Item number 2, SB 955, to pass the amendment. Current vote count is 6-2. Call the absent members.
Wolk.
Aye.
Wolk, aye.
Current vote count is 7-2. That bill is out. Item number 3, SB 1002, Monning. Current vote count is 6-2. Call the absent members.
Wolk. Wolk, aye.
That vote count is 7-2, and that bill is out, and that concludes the business of today. Thank you. We're adjourned.